What are the primary differences between BSL, BSL-2, and BSL-3 containment levels, and how do these differences affect laboratory practices? Answer: biosafety levels. BSL are a series of classifications used to define the safety precautions required for handling specific types of pathogens in a laboratory setting. BSL-1. This level is for agents that pose minimal risk to personnel and the environment. Basic laboratory practices are adequate, such as hand washing, using gloves, and ensuring proper lab attire. No special containment equipment is required, and standard laboratory equipment is sufficient. BSL-2. This level applies to agents that may pose moderate risks. Additional precautions are necessary, such as restricted access, biosafety cabinets, Closoman 2 in personal protective equipment, PPE, like lab coats and gloves. Infections associated with BSL-2 pathogens are treatable, but exposure could cause illness. BSL-3. This level is used for agents that can cause serious or potentially lethal disease via inhalation. Labs operating at this level are equipped with enhanced engineering controls such as biological safety cabinets, Class I arome through HEPA-filtered exhaust systems, and controlled access to ensure proper containment. PPE is mandatory, including respirators and full-body suits in some cases. How does proper animal facility design contribute to biosecurity, and what are the key features that must be included in the design of a high-containment facility? Answer: proper design of an animal facility is essential for biosecurity, ensuring that pathogens are contained within specific areas and minimizing the risk of cross-contamination between animal groups and between the facility and the outside environment. Key features of high-containment facility design include separate animal groups. Facilities should be designed with distinct zones for different species or pathogen levels to prevent cross-contamination. Isolation rooms with proper barriers are necessary. Airflow systems, high-efficiency particulate air HEPA filters, and negative pressure rooms are essential for BSL-3 and BSL-4 facilities to prevent airborne pathogens from escaping. Controlled access points, restricted entry and exit points with proper decontamination protocols, e.g. airlocks, hand-washing stations, and shower facilities are critical. Waste and sanitation systems, effective waste disposal and decontamination procedures, such as autoclaving waste before disposal, are critical components in high-containment facilities. Mrs. Thompson works in an ET2 laboratory and is tasked with handling non-human primates that are known carriers of a zoonotic disease. During an experimental procedure, she is accidentally exposed to an animal's blood. What immediate steps should Mrs. Thompson take to ensure her safety and prevent any potential zoonotic transmission? Answer: in this situation, Mrs. Thompson should follow the established procedures for exposure to blood-borne pathogens, which include immediate decontamination. She should immediately wash the exposed area with soap and water. If there is a risk of blood splatter, she should rinse her eyes or mucous membranes with an eye wash station or saline solution. Notify the supervising personnel. She should report the incident to the laboratory supervisor and the occupational health and safety officer immediately. Exposure documentation and risk assessment. The facility's exposure control plan should be followed, including completing an exposure report and assessing the risk of zoonotic transmission. A health evaluation and potential post-exposure prophylaxis may be recommended based on the nature of the exposure. Medical follow-up. Mrs. Thompson should seek medical attention for any potential treatment or monitoring, such as a tetanus shot or prophylactic treatment for potential zoonotic diseases, depending on the species and the pathogen involved. Relevant guidelines. This process is aligned with the CDC's guidelines for the prevention of zoonotic infections and the OSHA bloodborne pathogen standard 29 CFR 1910.1030. What are the best practices for preventing cross-contamination between different animal groups in a research facility, and why is it critical to implement these practices? Answer: preventing cross-contamination is crucial in maintaining the integrity of research results and ensuring the safety of both animals and staff. Key practices include physical barriers, designing separate rooms and equipment for each animal group, e.g. isolation rooms helps to minimize contact between animals from different species or research groups. Decontamination procedures, strict protocols for decontaminating equipment, cages, and surfaces between animal groups, including the use of disinfectants and sterilization procedures like autoclaving. Airflow control, Maintaining negative air pressure in rooms housing potentially infected animals ensures that airborne pathogens do not spread to other areas. Dedicated personnel and PPE. Assigning specific staff to particular animal groups and requiring personal protective equipment. PPE helps to prevent the unintentional transfer of pathogens between animal groups. Relevant guidelines. These practices are recommended in the Guide for the Care and Use of Laboratory Animals, 8th edition, published by the National Research Council and the CDNIR-BMBL. What are the key components of a waste disposal and decontamination program in a laboratory animal facility, and why are these procedures important for maintaining a safe working environment? Answer: a comprehensive waste disposal and decontamination program ensures that all potentially hazardous materials, including biological waste, are properly managed to protect both personnel and the environment. Key components include autoclaving. All contaminated waste, such as animal carcasses, bedding, and unused chemicals, should be sterilized by autoclaving to eliminate pathogens. Chemical disinfection. Items that cannot be autoclaved should be decontaminated using appropriate disinfectants that are effective against the pathogens in the facility. Secure waste storage. Contaminated materials should be stored in clearly marked, sealed containers until they are processed, ensuring that they cannot be accessed by unauthorized personnel. Waste segregation. Waste should be segregated based on its type, e.g., Sharp's biological waste, chemical waste, to facilitate appropriate handling and disposal. Importance. These procedures prevent the spread of infectious agents and ensure that the facility remains safe for both personnel and animals. Explain the role of HVAC systems in maintaining a safe and compliant animal facility, particularly with regard to pathogen containment and air quality. Answer: HVAC, heating, ventilation, and air conditioning systems are essential in maintaining a controlled and safe environment within animal facilities, particularly with regard to pathogen containment, airflow, and pressure control. HVAC systems must be designed to create negative pressure in isolation rooms and ensure that contaminated air is not allowed to escape into clean areas. This prevents cross-contamination between animal groups and minimizes the risk of airborne pathogens. Filtration. HEPA filters are a critical component of HVAC systems, ensuring that airborne particles, including viruses, bacteria, and fungi, are removed from the air before it exits the room. Temperature and humidity control. Proper regulation of temperature and humidity is necessary for both animal welfare and for preventing the growth of pathogens that thrive in specific environmental conditions. Relevant guidelines. The American Society of Heating, Refrigerating, and Air Conditioning Engineers ASHRAE and the CDC's Biosafety in Microbiological and Biomedical Laboratories outline the standards for HVAC systems in laboratory animal facilities. Mr. Patel is working in a Bear 3 facility and is tasked with cleaning the animal rooms after an experiment involving a highly contagious pathogen. He is unsure about the decontamination methods to use for the cleaning equipment and surfaces. What protocols should Mr. Patel follow to ensure effective decontamination and avoid cross-contamination? Answer: Mr. Patel should follow the following steps for decontamination. Personal protective equipment (PPE). Before starting the cleaning process, Mr. Patel should ensure that he is wearing the proper PPE, which may include gloves, gown, face shield, and respirator. Surface decontamination. All surfaces, including cages, benches, and equipment, should be thoroughly cleaned using an appropriate disinfectant effective against the pathogen involved in the experiment. Autoclaving or chemical sterilization. Equipment that can be autoclaved should be sterilized to kill any remaining pathogens. For non-autoclavable items, chemical sterilants should be used according to the manufacturer's guidelines. Air handling. Ensure that the HVAC system is functioning properly to maintain negative pressure and prevent contamination of surrounding areas. Post-cleaning procedures. Mr. Patel should properly dispose of contaminated materials and ensure that his PPE is removed and disposed of in designated areas. Relevant guidelines. The CDNIR-BMBL and ASHRAE standards for air quality control provide guidance on cleaning and decontamination procedures in BSL-3 settings. What are zoonotic diseases, and why is their management particularly important in laboratory animal facilities? Answer: zoonotic diseases are those that can be transmitted between animals and humans. Effective management of zoonotic diseases in laboratory animal facilities is critical to protect both the workers and the general public. Transmission routes. Zoonotic diseases can be transmitted via direct contact with infected animals, animal tissues, or fluids, as well as through vectors such as insects. Precautions. Standard precautions such as PPE, use, proper handling and disposal of animal waste, and vaccination of personnel against specific diseases are essential in preventing zoonotic transmission. Management. If a zoonotic disease is suspected, immediate isolation of the affected animal and appropriate testing should be conducted. Infected individuals should receive medical care, and the facility should implement quarantine protocols to limit further exposure. Relevant guidelines: the CDC Zoonotic Diseases Guidelines and the NIH Guidelines for research involving recombinant DNA molecules outline necessary precautions for handling animals that may harbor zoonotic pathogens. How do cleaning and sanitizing procedures contribute to maintaining a safe and sterile environment in animal facilities, and what are the key steps in these procedures? Answer: cleaning and sanitizing procedures are essential for maintaining the sterility of the animal facility and preventing the spread of pathogens. The steps include pre-cleaning. Surfaces should be cleared of visible debris and organic matter before disinfection. After cleaning, appropriate disinfectants should be applied to surfaces, focusing on areas that come into direct contact with animals. Rinsing and drying. After disinfection, surfaces should be thoroughly rinsed and dried to remove any remaining disinfectant residue. Routine cleaning schedule. Regular cleaning of animal cages, equipment, and high-touch surfaces is necessary to prevent pathogen buildup. Relevant guidelines: the CDBMBL and the PA guidelines for disinfectants used in laboratories provide the necessary procedures for effective cleaning and sanitizing. How should animal care staff be trained to ensure compliance with occupational health and safety standards in laboratory animal facilities? Answer: occupational health and safety training is crucial for ensuring that staff are protected from potential hazards in the laboratory animal facility. Key elements of training include proper use of PPE. Staff should be trained in the proper use, care, and disposal of PPE to protect against biological, chemical, and physical hazards. Awareness of hazards. Training should cover the specific risks associated with the animals housed in the facility, including zoonotic diseases, allergens, and physical injuries from animals. Emergency procedures. Staff should be familiar with the emergency protocols in the event of an exposure to hazardous materials or animal bites, including the immediate steps to take and who to contact for medical assistance. Vaccinations and health monitoring. Staff should be encouraged to stay up to date with recommended vaccinations and regular health monitoring to protect themselves from occupational hazards. Relevant guidelines: the OSHA Laboratory Standard 29 CFR 1910.1450 and the CE-NIB-MBL provide detailed recommendations for occupational health and safety training. What are the key components of an effective infection control program in an animal facility, and how do you ensure that each component is being properly implemented? Answer: an effective infection control program in an animal facility includes several key components. Risk assessment, identifying potential sources of infection and evaluating the risk of disease transmission within the facility. This includes assessing animal populations, staff practices, and environmental factors. Surveillance and monitoring, routine monitoring for symptoms of disease among both animals and staff. Implementing diagnostic testing, e.g., PCR, serology to identify carriers of pathogens before they spread. Hygiene and sanitation, implementing strict cleaning and disinfection protocols. Facilities should ensure that all surfaces are disinfected according to established guidelines, and personnel must adhere to hand hygiene practices. Personal protective equipment, PPE, ensuring that all personnel wear appropriate PPE, gloves, masks, gowns, etc., to prevent cross-contamination between animals and between personnel. Isolation procedures, isolating affected animals and segregating incoming animals from established colonies to reduce the risk of infection. Explain the importance of preventive medicine in laboratory animal care and outline the general vaccination protocols for commonly used laboratory animals. Answer: preventive medicine is critical in laboratory animal care as it helps to maintain the health of animals, which is essential for ensuring valid and reproducible research results. Preventive medicine programs aim to prevent disease outbreaks, ensure that animals are free from pathogens, and provide early intervention when necessary. Vaccination protocols vary by species, but typically involve rodents. Vaccines are often administered for common pathogens such as Sendai virus, Killam rat virus, and mouse hepatitis virus (MHV). Protocols usually involve early life vaccination or when animals are introduced to a new colony, primates. Vaccinations for primates often include vaccines for diseases such as simian immunodeficiency virus, CIV herpes virus, and other diseases relevant to the species. Vaccination should be tailored based on the animal's health status and the potential exposure risks in the research environment. Canines, felines. Vaccines for common viruses such as canine parvovirus, rabies, and feline leukemia may be required, especially if the animals are involved in long-term studies or exposed to environmental risks. Dr. Emily, a laboratory animal technician, notices that several rabbits in a research colony have started showing signs of respiratory distress and reduced activity levels. What steps should Dr. Emily take to manage the situation, considering infection control and disease containment protocols? Answer: Dr. Emily should take the following steps. Isolate affected animals. Immediately isolate the affected rabbits from the rest of the colony to prevent the spread of potential infection. This can be done by moving them to a separate quarantine area, report to veterinary staff, and notify the veterinary team to assess the animals and perform diagnostic tests to identify the cause of the symptoms. Conduct surveillance. Perform a comprehensive check on all animals in the colony to monitor for any other signs of illness, review recent arrivals, investigate any recent arrivals to the colony and determine if they may have introduced the infection, quarantine new animals upon arrival and monitor for symptoms, disinfection protocols. We will ensure that all equipment, cages and the environment are thoroughly disinfected to eliminate the possibility of spreading infectious agents, vaccination and treatment. Depending on the diagnosis, the veterinarian may recommend specific treatments such as antibiotics or antivirals, or consider vaccination if a preventable disease is identified. How does pathogen surveillance contribute to maintaining a healthy environment in an animal research facility, and what are the best practices for implementing a pathogen surveillance program? Answer: pathogen surveillance plays a crucial role in identifying potential pathogens before they cause widespread illness in animals, thus maintaining a healthy environment and ensuring the integrity of research data. Key aspects of a pathogen surveillance program include regular testing, routine screening for common pathogens, e.g. viruses, bacteria, fungi, should be conducted using methods such as PCR, serology, or culture tests. This should be done periodically, especially for high-risk animals. Cohort surveillance. Monitoring groups of animals that share common characteristics, e.g. age, species, or who have been housed together. Environmental monitoring. In addition to testing animals, surfaces and air quality should be monitored for potential pathogen contamination. Quarantine and entry control. Animals entering the facility should be screened for pathogens and quarantined to avoid the introduction of new diseases. Staff training. Proper staff training on pathogen recognition and prevention techniques, including the use of personal protective equipment and hygiene protocols. What is the importance of proper isolation protocols for diseased animals in a research setting, and how should isolation be managed to prevent the spread of infection? Answer: proper isolation of diseased animals is essential for controlling the spread of infectious diseases within a research facility. Isolation prevents pathogens from spreading to healthy animals and helps to limit the impact of disease outbreaks on research outcomes. To manage isolation effectively, quarantine area. A designated, controlled area should be used for isolating infected animals. This area should be separate from the main animal housing units, and access should be restricted to authorized personnel only. Physical barriers. Barriers such as sealed doors, high-efficiency particulate air, HEPA filtration, and negative pressure environments should be used to prevent airborne transmission. Disinfection protocols. All equipment and surfaces that come in contact with infected animals should be thoroughly disinfected. A specific cleaning protocol for the isolation area should be established to prevent cross-contamination. Monitoring and care. Isolated animals should receive close monitoring for clinical signs and veterinary care. Staff should be trained to identify symptoms and report them promptly. Documentation. Proper record-keeping of the isolation period, disease monitoring, and actions taken during the isolation process is crucial for regulatory compliance. Explain the factors that influence the determination of drug dosage in laboratory animals, and describe how the method of administration affects drug efficacy and safety. Answer: the determination of drug dosage in laboratory animals is influenced by several factors, including animal species and size. Different species have varying metabolic rates, so the drug dosage must be adjusted accordingly. Larger animals typically require higher doses. Age and health status. The age, weight, and health of the animal can affect how the drug is metabolized. Younger animals may require different dosages compared to adults. Sick animals may metabolize drugs differently, requiring adjustments. Drug characteristics. The pharmacokinetic properties of the drug e.g., absorption, distribution, metabolism, elimination, play a role in determining the appropriate dosage, method of administration. Routes such as oral, subcutaneous, intravenous, and intramuscular affect how the drug is absorbed and metabolized. For instance, intravenous administration leads to faster drug absorption and higher bioavailability compared to oral administration. Purpose of use. The dosage can also be influenced by whether the drug is being used for pain relief, anesthesia, or another therapeutic purpose. Administering the correct dose through the appropriate route ensures optimal therapeutic effects while minimizing the risk of adverse effects. What are the key principles of pharmacology and toxicology that are crucial for ensuring safe and effective drug use in laboratory animals? Answer. In laboratory animals, the principles of pharmacology, the study of drug action, and toxicology, the study of harmful effects of substances, guide the safe and effective use of drugs. Key principles include pharmacokinetics, understanding how the body absorbs, distributes, metabolizes, and eliminates a drug. This is essential for determining dosing schedules and ensuring efficacy. Pharmacodynamics, how the drug produces its effects in the body, including the mechanism of action and the relationship between drug concentration and effect. Toxicology, identifying the potential harmful effects of drugs, including acute and chronic toxicity. This involves studying dose-response relationships and identifying safe dosage ranges, safety margin, and ensuring that the therapeutic dose is far below the toxic dose, creating a safety margin to minimize the risk of adverse reactions. Species-specific reactions, recognizing that different species may respond differently to the same drug and adjusting protocols accordingly to minimize risks. Adverse drug reactions and monitoring for and managing any unexpected negative effects, including immune responses, gastrointestinal issues, or organ toxicity. What are the most commonly used drugs in laboratory animal research, and what are their primary uses? Answer. Commonly used drugs in laboratory animal research include anesthetics, isoflurane, ketamine, used to induce controlled states of unconsciousness for surgical procedures or experiments requiring immobilization. Antibiotics, amoxicillin and rofloxacin, prescribed to treat or prevent bacterial infections that may occur in laboratory animals, especially following surgeries or invasive procedures. Pain relievers, morphine, buprenorphine, administered to manage pain associated with surgery or injury. Pain management is crucial to maintain the welfare of the animal and to prevent pain from interfering with research results. Sedatives, diazepam, used to calm animals and reduce anxiety during procedures or when handling. Antifungals, itraconazole, used to treat fungal infections, particularly in immunocompromised animals. These drugs help to manage the health of laboratory animals, ensure their well-being, and facilitate research procedures. What methods and protocols should be followed to monitor adverse drug reactions in laboratory animals, and how can these reactions be mitigated? Answer. Monitoring for adverse drug reactions involves several methods. Clinical observation, monitoring the animals for behavioral changes, physical symptoms, or signs of distress such as lethargy, changes in appetite, and abnormal postures. Laboratory testing, performing blood tests, urinalysis, or liver and kidney function tests to detect biochemical changes associated with it, as histopathology, examining tissue samples from affected organs to identify any pathological changes that may be indicative of toxicity. Documentation and reporting, maintaining detailed records of any suspected errors, including the drug involved, the dose, and the timing of the reaction to mitigate errors. The technician should follow dosage guidelines, ensure that drug dosages and administration routes adhere to established protocols, monitor animals closely, observe animals more frequently during and after drug administration, especially when introducing new medications. Immediate action. If an ADI is suspected, consult the veterinary staff to determine appropriate interventions, e.g., discontinuing the drug, administering an antidote. What steps are involved in conducting toxicology studies in laboratory animals, and what safety protocols must be followed during these studies? Answer. Toxicology studies in laboratory animals involve several key steps. Dose selection, determining an appropriate starting dose based on prior research, or using a dose escalation protocol to identify the no observed adverse effect level, NOAEL. Study design, developing a study that includes control groups, varying dosages, and appropriate time points for observing toxicity. Monitoring, animals are monitored for clinical signs of toxicity, including changes in behavior, appearance, and physiological responses. Endpoint determination, identifying the appropriate endpoints for the study, such as survival, weight loss, or organ dysfunction. Safety protocols include Ethical approval. Obtaining proper ethical clearance before initiating any study involving potentially harmful substances. Use of PPE. Researchers handling toxic agents should wear appropriate protective equipment, including gloves, gowns, and face shields. Emergency procedures. Establishing emergency protocols for handling accidental exposure or spillage of toxic substances. What are the key differences between the symptoms of respiratory diseases in rodents and those in rabbits, and how would you manage biosecurity in a laboratory environment to mitigate the spread of such diseases? Answer. Respiratory diseases in rodents often present with symptoms such as labored breathing, nasal discharge, and lethargy, which can be linked to bacterial infections like Pseudomonas aeruginosa or Mycoplasma pulmonis. In contrast, rabbits may exhibit nasal discharge, conjunctivitis, and sneezing commonly associated with Pasteurella multicida. To mitigate the spread of respiratory diseases in a laboratory setting, strict biosecurity measures are required, including isolating infected animals to prevent cross-contamination, implementing sanitation protocols such as disinfecting cages and equipment, ensuring ventilation is adequate to minimize airborne transmission, following guidelines set forth by organizations such as the American Association for Laboratory Animal Science (OLAS) and the U.S. Department of Agriculture (USDA), or maintaining pathogen-free environments. Regular health surveillance of all animals is essential for early detection. How does the use of local anesthesia during procedures on small rodents differ from its use in larger laboratory animals such as pigs or dogs? Discuss the considerations regarding dosage and technique. Answer. Local anesthesia in small rodents typically involves the use of agents like lidocaine or bupivacaine administered in smaller doses due to their smaller size and higher metabolic rate. For larger animals such as pigs or dogs, local anesthetics are dosed based on body weight and surface area. Considerations include species differences. Larger animals require more extensive area coverage and possibly a different selection of anesthetics. Tissue perfusion. In rodents, higher blood flow can affect the absorption and duration of local anesthetics. Depth of anesthesia. For pigs or dogs, deeper or multiple injections may be necessary to ensure sufficient pain management during surgical procedures. Guidelines from the American Veterinary Medical Association (AVMA) and National Institutes of Health emphasize the need for appropriate dosing and monitoring to avoid under or overdosing, as well as ensuring that analgesia lasts throughout the procedure. Mr. Davis is a laboratory technician working with rats in a research study. He notices that one of the rats has developed significant swelling in its abdomen and signs of distress following an injection of anesthesia. Mr. Davis immediately checks the anesthetic dose and finds no discrepancies. What should Mr. Davis do next to manage the situation effectively? Answer. Mr. Davis should first assess the vital signs of the rat, including heart rate, respiration rate, and body temperature, to determine the severity of the condition. Given the signs of distress and abdominal swelling, he should consider the possibility of anaphylactic shock or intraperitoneal injection complications, e.g., leakage of anesthetic into the peritoneum. The immediate steps would be administer emergency fluids such as saline to maintain blood pressure, reassess anesthesia depth, and, if necessary, reverse the anesthetic using appropriate antagonists, e.g., naloxone for opioids. If shock is suspected, administer corticosteroids or antihistamines under veterinary guidance. Isolate the animal and monitor it closely while seeking further veterinary consultation. Mr. Davis should report the incident and follow institutional guidelines on post-event documentation and corrective actions as outlined in the Animal Welfare Act. What are the ethical considerations and scientific guidelines for determining the most appropriate euthanasia method for laboratory mice in an experiment? Answer. The choice of euthanasia method for laboratory mice must balance both scientific objectives and ethical principles outlined in the Guide for the Care and Use of Laboratory Animals, 8th edition. Ethical considerations include minimizing pain and distress. The euthanasia method should cause as little suffering as possible. Co-inhalation is often used for small rodents as it induces rapid unconsciousness and is considered humane if properly administered. Humane techniques. Techniques such as cervical dislocation or injection of euthyosol, sodium pentobarbital, are also acceptable but require trained personnel to ensure a swift, painless process. Species-specific needs. Mice are more sensitive to certain gases, and methods such as barbiturate overdose may be preferred over gas administration in some cases, especially if CO is not well tolerated. Institutional review boards and oversight committees should ensure that euthanasia is conducted in accordance with guidelines set by the AVMA and NIH Office of Laboratory Animal Welfare (OLAW). What are the key aspects of implementing an effective sanitation and quarantine protocol to prevent the introduction of infectious diseases in a newly established laboratory animal colony? Answer: effective sanitation and quarantine protocols are crucial to preventing the introduction of diseases in a laboratory animal colony. Key aspects include quarantine. New animals should be isolated for a period, typically 1430 days, in a separate facility to monitor for any signs of infection. During this time, animals should undergo veterinary screenings and health checks. Sanitation. Strict cleaning protocols should be followed for all equipment and animal housing areas. Disinfection with EPA-approved agents must be done regularly, especially between animal cohorts. Monitoring. Regular health surveillance programs should be in place, including periodic testing for common pathogens such as Sendai virus or Mycoplasma. Staff hygiene. Personnel must adhere to rigorous hygiene standards, including hand washing, glove usage, and protective clothing to prevent cross-contamination. These protocols should be in alignment with the Centers for Disease Control and Prevention (CDC) and AALAS standards for disease prevention. Explain the importance of maintaining aseptic technique during animal surgeries and the potential risks of non-compliance in laboratory animal procedures. Answer: maintaining aseptic technique during surgeries is critical to prevent infection and ensure the safety and well-being of laboratory animals. Key principles include sterilization of instruments. All surgical tools should be sterilized using autoclaves or other methods to eliminate microbial contamination. Surgical site preparation. The area of incision should be cleaned using antiseptics, and sterile drapes should be used to cover the animal and surrounding area. Personnel hygiene. Surgical team members must wear sterile gloves, gowns, and face protection to minimize the risk of introducing pathogens into the surgical field. The risks of failing to maintain aseptic technique include post-surgical infections, delayed healing, or sepsis, which can result in increased animal suffering and potentially compromise the integrity of experimental results. These procedures are outlined in NIH guidelines and must be strictly adhered to by the research institution. Compare the advantages and disadvantages of injectable anesthesia e.g. ketamine versus inhalant anesthesia e.g. isoflurane in laboratory rodents during minor procedures. Answer: injectable anesthesia e.g. ketamine offers the advantage of being easy to administer and effective for short, less invasive procedures. However, it may cause respiratory depression and prolonged recovery in some rodents. It is also difficult to adjust the anesthetic depth once administered. Advantages: easy to administer, less expensive, rapid induction. Disadvantages: variable duration, potential for incomplete anesthesia, slow recovery. On the other hand, inhalant anesthesia e.g. isoflurane provides more controlled depth of anesthesia, allowing for easier adjustment during procedures. It is commonly used for longer surgeries and offers quicker recovery. Advantages: more controlled, faster recovery, less tissue irritation. Disadvantages: requires specialized equipment, vaporizer, oxygen source, can be more expensive. Both methods have their place, but inhalants are generally preferred for procedures requiring precise anesthesia management. What are the common methods used to manage ectoparasite infestations in laboratory animals, and what are the potential risks associated with these treatments? Answer: common methods to control ectoparasites, e.g. fleas, mites, in laboratory animals include topical treatments, application of acaricides or insecticides such as ivermectin or permethrin, environmental control, regular cleaning and disinfecting of cages and bedding to reduce parasite populations, systemic treatments. In some cases, oral or injectable medications may be used for more extensive infestations. However, these treatments carry risks, including toxicity if overdosed, resistance in parasite populations, or potential disruption to the animal's immune system. Close monitoring of the animals and adherence to veterinary guidance is essential to mitigate these risks. Explain the role of temperature monitoring during anesthesia in laboratory animals and its significance for preventing adverse effects during surgery. Answer: temperature regulation is vital during anesthesia, as anesthetic agents can interfere with the animal's ability to maintain normal body temperature, leading to hypothermia or hypothermia. During surgery, animals may experience a decrease in body temperature due to the anesthetic-induced suppression of thermoregulation. This can lead to increased risk of infection, slow recovery, and impaired tissue healing. Monitoring body temperature throughout the procedure is essential. If the temperature falls below normal levels, measures such as using warming blankets, heating pads, or radiant heat sources should be implemented to maintain a stable temperature. Guidelines from the American College of Laboratory Animal Medicine, ACLAM, and the AVMA emphasize the need for temperature monitoring, particularly for longer surgeries or during procedures involving vulnerable animals. Describe the criteria for determining when euthanasia is appropriate for a laboratory animal and explain the ethical implications of euthanizing animals based on these criteria. Answer: euthanasia is considered appropriate when an animal's suffering exceeds acceptable levels, when the animal's condition is incompatible with life or scientific objectives, or when continuing the animal's care would cause undue distress. Key criteria for determining euthanasia include clinical signs of severe pain or distress that are unmanageable with analgesia, failure to recover from anesthesia or other treatments indicating poor prognosis, progressive diseases or conditions that are incompatible with life or experimental integrity. Ethical implications involve balancing the duty to minimize suffering with scientific necessity. The AVMA guidelines for the euthanasia of animals emphasize the need for a humane, quick, and painless death to reduce animal suffering. Euthanasia decisions should be reviewed and justified by ethical committees to ensure that it is in line with research goals and animal welfare regulations.